Yes, as Dr. Deal said, I'm Matt Madion. I'm PGY5 at MCW, and we'll be talking about perspectives of a curriculum survey that we did. So, I have no disclosures. Don't need to spend 7 seconds telling you that. So just as a quick overview, I'll comment on the rising use of robotics in general surgery and why this is important for our trainees moving forward, and then get into the details of the methods and results of our survey that focus on a couple different things, including demographics, some opinions of the program directors, and then the robotic experience from the residents, at least from the program director's perspectives, and some conclusions we can make moving forward with this. So as we all know, there's a rising utilization of robotic assistance in general surgery. Some studies have shown actually an 8-fold increase in robotic-assisted procedures with common general surgery procedures in the last 10 years. And as a result of this, there's an increase in the incorporation of robotics in training curricula for general surgery residents. But there's a need for a review of this curricula as the rise has happened drastically in the last 10 years. So we distributed a 19-item survey through the Association of Program Directors in Surgery listserv. I won't be able to comment on every item that was addressed there, but the focuses were some demographic questions, some questions about the opinions of program directors about robotic surgery, and then specific questions regarding the robotic surgery curriculum, should they have it. Qualtrics, Excel, and IBM SS were used for compilation and analysis, and the statistical analysis was a chi-square analysis, which we'll see here. So out of the 280 possible respondees, there's 107 who responded. The distribution of the category of the general surgery residency for which they identified can be seen at the top of the screen. And of those 107 responses, 70% of them said that they had a formal robotic surgery training curriculum in place at that time. The other remaining 30% actually stated that they planned, 90% of those planned on starting one in the next 1 to 2 years. Specific barriers that were listed that were preventing incorporation at that time were faculty buy-in and finances were the two highest reasons for barriers. So when looking at some of the opinions of program directors regarding robotic surgery, when asked how important is robotic surgery to general surgery training, there was a statistically significant difference in the responders who had a formal curriculum in place, in that they had a higher proportion who felt that it was probably important or very important compared to responders who did not have a formal curriculum in place, which is relatively intuitive when you think about it. However, in terms of whether or not these cases interfere with residents' participation in learning a surgical procedure, there was no statistically significant difference with the majority of responders either disagreeing or strongly disagreeing with the fact that there was some interference with surgical procedure learning. When looking at the actual, some curriculum details, of the curriculum that were in place, most were in place for either less than a year or 2 to 3 years at the time of the survey, and most began in PGY 1 or 2 year. There is no difference between the category of residency programs with any of these results. When looking at the actual training offerings and curriculum offerings that these that the programs offered, over 90% all offered online robotic training modules, hands-on skills labs and in-service sessions, and technical skills simulation, with just over 50% offering didactic sessions and lectures, so a smaller proportion offering didactics. And I think here's probably the slide to pay the most attention to, at least from my perspective as a resident trainee. So programs reported that most of their trainees, PGY 1 or 2, started bedside assisting during those years. However, PGY 3 year is the year where there was most commonly starting to operate on the console, with PGY 2 year being second for that. And then when asked what percentage of do senior residents spend operating on the robotic console during robotic cases, there was a pretty broad response rate from program directors, with over half of the program directors saying that the residents were spending less than 50% of the time actually operating on the console. which as a trainee, when you've been working towards this case and hoping to get on the console, that percentage of time is significant. You can measure it when you're on the robotic console, which I think is kind of unique to robotic surgery. And then finally, of the programs that had curriculum in place, 64% of them stated that their residents were graduating with training equivalency certificates in robotic surgery. So what can we conclude from this? It's obvious that a majority of programs are now incorporating a formal robotic surgery curriculum into their residencies, with most of them beginning in PGY 1 or 2 year. A lot of them are new, having been present for less than 3 years at the time of the survey, and despite them all sort of stating that they have similar curriculum offerings in terms of what they're offering the residents during training, there's a variability in the percentage that these residents are actually on the console and participating in from that regard. And I think with a standardization of a curriculum, we could help define some operative milestones for residents to overcome the current educational barriers, as well as the educational barriers that are going to be unforeseen with the increasing utilization of robotics, both in general surgery and with the trainees. I thank you for your time, and I'll take any questions.